Education Committee and Special Committee of the Whole. I'm Daryl O'Quinn, chairperson for the Education Committee, and see we're joined by Councilor Clinton Woods, Councilor Stephen Hoyt, our other colleague on this committee, may join us at some point. But today is Monday, May 17th. It's roughly noon, and we're going to go ahead and get started. And our first item of business is to consider the minutes of the April meeting. Ms. Arlene, if you didn't receive those previously, Ms. Arlene and Kim have just sent those out a few minutes ago. The April meeting, just as a refresher, was a informational meeting where we heard from two of our local charter schools, Legacy Prep and I3 Academy. If there are no additions or corrections to those minutes, we'll entertain a motion to approve them as written.
Yes, I move approval of the April 19th minutes.
All right, second, all in favor say aye. Aye.
Aye.
That motion passes. And today, once again, our meeting is more of an informational meeting. And our first guest speaker today is Dr. Mark Sullivan, Superintendent of Birmingham City Schools. And he's going to be telling us about some of the summer programming that they have lined up for our kids this coming summer. Dr. Sullivan.
Thank you so much, Councilor Quinn, as well as Councilor Woods. We have on the call with us our academic officer, Dr. Jermaine Dawson, as well as our curriculum instruction director, Pamela Williams, and they've been working very diligently to put together a robust set of summer programs. I think I want to start off by kind of building some context, and then we'll talk about what our summer programs are. And I see that we have Dr. Mark Wilson on the call, and so that kind of provides us with some additional context. Last year, actually, it was about a year and a half ago, March of last year, when the whole world shut down. We in Birmingham City Schools, we stopped face-to-face instruction, along with school systems across the state and the nation. We recognized at the time that many of our students did not have devices, nor did they have hotspots. About 25% of our students were in that situation. One of the things that our school board did very wisely this past summer was to invest heavily in technology. And that's one of the things that probably will not go away as we come out of COVID-19. And one of the things that we recognize as part of this pandemic is that it's shown a light on the inequities in education, particularly among students with technology, as well as food insecurity, because over the past year, even though school has not been in every day, we have provided meals for students every academic day for our students since last summer. We started the school year off in a virtual mode because the number of cases in our local community was around 14%. We saw a decrease in the number of cases in October, and we brought our children back. We recognized, because we did assessments while our students were out, that there was significant learning loss, not just in Birmingham, but across the nation and across the state as it relates to COVID-19. We brought our students back, but we had to go back virtual because the percentage of cases in December after Thanksgiving holiday and in January was around 21%. And during the course of this year, we lost 4 staff members to COVID-19. In addition, to many of our employees and their families were affected by this disease. One of the things that we recognize is that as we begin to get people vaccinated, and as the percentage of cases in our local community goes down, is that we have to be aggressive in how we address this learning loss. One of the ways that we're going to do that is through our summer programs. And so we're very proud of the work of our academic team in putting together these programs. We're also very proud of the work of our community partners, because as you'll see, we have a lot of partnerships, because this is going to be a heavy lift. And it's not just on the school system alone, although we are driving this horse or driving this car forward, but we are doing it with the support of many organizations like the A.J. Gasson Boys and Girls Club and the YMCA, under the umbrella of Bows Goals Coalition. We are just very proud of the work that those individuals will be doing this summer. And we are providing all of these activities absolutely free, and we're having meals for our students, breakfast and lunch during the academic day, and after school care for students who are in kindergarten through 5th grade whose parents can't pick them up after summer school is over. But with that as being a starting point, I'm going to turn it over to Dr. Dawson and Dr. Williams to go in depth around what our summer programs are going to look like this year. Dr. Dawson.
Yes, thank you so much, Dr. Sullivan, and good afternoon to everyone here today. We're very excited, as Dr. Sullivan has stated, around the vision that he has set for us. He gave us a mandate to make sure that we reach all of our students and that we work diligently to close the achievement gap for our students because of unfinished learning that is taking place as a result of the pandemic. I am happy to have with me also today Dr. Pam Williams, who also serves on our team to support this work. Is there an opportunity for us to be able to share our screen?
Certainly. Who would like the sharing privileges?
If I can share first, and then I'm going to turn it over to Dr. Williams, and then she's going to share a piece, and then it will come back to me.
All right. You should have the ability to do that now.
Okay, let me see here. And it's still giving me this button at the bottom saying open system preferences. Let me see here. Give me 1 second.
Like I said, technology, you have to love it when it works.
I tell you. I'm clicking the button here. Give me 1 second. All right, I think we are. Let's see if this app gave us the ability here, and I've clicked for it to give me the ability to share my screen, but it's not allowing me, still not allowing me to do so.
Dr. Williams, do you think you can share?
I have also been trying. I'm not able to share, Dr. Sullivan.
Let me see. It's unlocked.
Now it's saying I can. Yes, I can share now.
Okay, let me send it to you 1 second, Dr. Williams.
Okay.
This presentation. I'm sorry about that. The system is not allowing me to share this screen.
Okay.
So while we're talking about it, we did an extensive work with our partners. And one of the things that we wanted to do as we were working with our partners were to ensure that they had an opportunity, as Dr. Sullivan has stated, to be involved in this work with us as relates to summer school. And so we met with our partners in March. And when we met with our partners, we worked to have them to be a part of this work that we were doing. We had sessions where they had to complete an application. And while completing the application, we met with them in one-on-ones to talk about what our specific needs were in our schools and to hear how they will be able to support us in that effort. We gave them a timeline of how we will work together with them as we did with our schools. In that timeline, we presented the comprehensive plan to our board in March. We received board approval in April, and then we pulled our partners back together about 2 weeks ago to really outline how we would be able to make sure that they were abreast and aware of how they can support us around safety measures. I think, yes, that is the presentation. So if you can put full screen for me, Dr. Williams. Would allow you to go full screen. Good, great technology, right? There we go. All right. So as I'm happy, I am Jermaine Dawson. I'm here with Dr. Williams. Next slide, Dr. Williams. So as you can see from our Learning Strong program, as we met with our partners and as we met with our schools, we outlined, because our school year is ending a little later this year. And so we wanted opportunity for our students to be able to transition from the regular school year into the summer. So when we met with our partners and we met with our schools, we outlined the requirement that we're putting in place this year, that we will have 2 days of orientation for all of our partners, all of our teachers that will be working in a summer program on June the 8th. That will be more of our day to talk about the safety around the nutritional program, the transportation, to make sure all the logistical pieces are up and everyone fully understands, so that when we hit the ground running, when our students come for summer planning, every summer school, everything will be laid out. On the 9th will be another day for professional development around the instructional components and an opportunity for teachers and partners to be able to set up their classrooms. Then there will be full 20 days of instruction for our summer school program. The first 16 of those will run through the month of June 10th through July 1st. And then we will observe July 5th as an off day, and then we will end our program on July 8th to give our students those full 20 days. Next slide. In those programs, we have outlined what these programs and where they will be for our credit recovery programs. This is similar for our students who need some additional support, may have not achieved the mark, if you will, to be able to matriculate to the next grade level. So we have opportunities for them to recover that learning that was lost, that unfinished learning through our district hubs, through face-to-face instruction, and also through virtual. We're going to be offering both options for our students in high schools. For our K through 12 students as well, we will have, similar to credit recovery, for our K through 8 students, all those students who may have not met the mark academically, to get an opportunity to recoup their learning so that they can matriculate with their peers and continue on to the next grade level. These are our hub sites. Will be for those students will be Woodlawn, Smith, Wilkerson, and that actually has been changed to Oxmoor Valley, and then Sun Valley, Robinson, and then West End Academy. And then we have our Learning Strong program. This is for students who met all the requirements. They are going to matriculate to the next grade with ease, but they want to have some opportunities to close some achievement gaps. This is a great opportunity for our advanced students or our gifted students to receive additional learning, or for our students who are going into those more robust types of courses, those algebras and geometry courses, those more advanced courses, to have that bridge of support to make sure that they're ready to hit the ground running on the first day of instruction. And then for all of our other students to be able to have an opportunity to learn. We're going to have coding, we're going to have opportunities for computer science, and other opportunities and fun opportunities for our students. And then the last part of that, as you know, or you may be well aware, Alabama has set out through the Alabama Literacy Act that all of our students must be reading on grade level by the time they enter third grade. And so we recognize that we have students who may not have met that mark, and then you add on top of that COVID-19. And so with that, we have a program in all of our elementary schools and all of our K-8 schools for grades K through 3 to be able to support our students who have been identified by the state as needing additional supports through our Alabama Literacy Act. We have teachers and partners who will be working with these students to support them in this effort. Next slide, Dr. Williams. Dr. Williams. Dr. Williams. You can go back.
Okay, so at this time, we're going to go to the site, and we're going to share with you what our summer programs site look like on the website, because we've worked very hard to make sure that our parents have easy access to the website. So it's going to take me just a second. Here we go. And I'm going to share the BCS website. So if you have not had a chance to go to our district website, please go to the website. Is it sharing, Dr. Dawson?
Yes, ma'am.
Okay, so we're at the district website. All parents have to do, or any partner, is click on that page that says Learning Strong, and it will take you to our BCS Summer Learning programs. And we have several pages for our parents. On the first page, we share with you parents our district-wide summer enrichment programs. Those are the programs that Dr. Dawson just shared. Learning Strong, these are programs that are for any student across the district, whether it doesn't matter what school, they can go to these programs, and we will provide transportation and breakfast and lunch. So these are district programs. If they click any of the links, it takes them directly to an application so that they can see to apply for that, how to apply for that particular program. We have several different application process. Well, two main processes. Let me clarify. One is for summer promotion and enrichment. So any student that is required to repeat a grade or go to summer school for grade recovery, they need to complete this application so that we can find out if they need transportation. Or if there's a student or parent that wants their child just to have enriching activities like Dr. Dawson shared, they can sign up using this link and select the appropriate program, and we will follow up with them. On the next page, we also have all of our K-8 schools or K-5 schools will be providing the Alabama literacy camps, and then other schools are also providing programs. So parents or interested partners can click on this link right here into the program book, and they can identify what schools are hosting programs, and they can use this information to sign up using the link that is just above the program. If they were to click here, they can apply for any program in the district at their home schools. So if I'm a student, say at Avondale, or a parent of a student at Avondale, I can sign my student up for that program using that link, and the school will follow up. We also list, as Dr. Dawson shared with that last slide that we stopped on, the partner camps and our host sites. Like he said, Woodlawn, Osceola, Wilkerson, Sun Valley, and Robinson and West End Academies are serving as our hub sites. There's more information for parents on the Alabama literacy camps. So
and Dr.
parents,
Williams, go back right quick and
yes.
show them. Can you go through and show them the partners again? That's actually going to be working with us.
Yes. These are the programs that we landed on the PowerPoint, but these programs will be in our schools hosting programs. We have over 15 partners working with us this summer to ensure that any student that needs summer enrichment can get access to a program. There's a multiple range of different types of programs, from Boys and Girl Scouts to summer brain camps to even we're having cell programs, Bold Girls Rock, just multiple types of programs that to reach all different types of learners. So we're very excited about the partner programs. And if you were to go back to that booklet, you can see which schools are hosting those programs. So in this book, you can find all of the partner programs on the section that says 2021 partner programs.
And a small descriptor which describes what activities will take place at that program.
Yes, sir. It will give you the description, the dates, the times, and the location. Then, like I said, the Alabama Literacy Camp information, many parents have been asking, what is the Literacy Act? What will kids experience during this summer? What's the purpose of the camp? We provide that information with dates and times as well. And again, those camps will be hosted at all of our K-5 and K-8 schools for students in grades kindergarten through 3rd grade. Our ESL camp will also be held this summer. It will be at Togle Elementary School, and our parents those parents can go to this site. Our EL parents and our teachers are reaching out to them personally, so they don't have to look for it. So they will receive a separate invite. So it is translated, and this site is also translated. And I'll show you that when I get back on the main page. As far as, and same thing for special education, we're also personally contacting all of our students and that need special needs. We will provide support for them across programs, not just for any programs that are provided by the department, but also the promotion and the summer enrichment programs. We'll have special education staff working alongside us as we do during the school year. So they won't, they will continue to receive their services. And again, like I said, this main site is translated in Spanish. So if our parents need that support, they can click here and they can view the same site from beginning to end. Well, I gotta sign in, but once I sign in, you'll be able to see it. They'll be able to view the site in Spanish. So there's multiple ways to get to the programs, but the main way is through our district website, again, going back to the home page. And I'll click there and go back to the presentation for Dr. Dawson.
Thank you, Dr. Williams,
Okay,
for sharing.
go back and let's see. I'm learning WebEx.
As we're both learning as we go.
Okay, I
The
think
next
I got the right one. Let me make sure.
So everything that you see, that's correct. Everything that you see on this slide is what Dr. Williams has so eloquently showed us. This is just a 30,000 feet level. And what she showed you was the full website with all of that pertinent information.
Get
On
the
the
right
next
one.
slide,
Okay, I'm putting it on the right one. Sorry. There you go. All right.
so on the next slide, as you can see, Dr. Williams already shared this information once again. We will go from June 8th to July 8th. The programs will be from 8 to 1 p.m. Students will be engaged in a plethora of learning opportunities from reading and math to STEM to coding, opportunities for them to be able to collaborate with their peers. It will be in-person learning. There will be virtual field trips for our students as well while they're in the learning. These are our hosting sites for our district hubs. And then next slide, Dr. Williams. Dr. Sullivan made it very clear that he wanted to make sure that parents have access and that as soon as the board gave approval, that the parents were able to hit the ground running. That link is there for parents to apply. The link has been open since April 19th. We have already received a number of parents who have completed the application process, and Dr. Williams and our team, and I want to personally thank Dr. Williams and our team for continuing to lead this particular piece and to oversee it and to make sure that we have a good, strong program. Next slide. And we're happy because Dr. Sullivan has also given us the vision that we want to make sure that all of our students, and he alluded to this earlier, will be provided a hot breakfast and lunch every single day that they're in the summer program. We want them to feel like they are in a safe learning environment, and we want to be able to meet their needs, not just academically, but also physically. And we're happy to report, as Dr. Sullivan has pushed to make sure that we make this happen, that transportation will be provided for all BS students, all BCS students that will be attending any of our summer programs this year. So with that, Dr. Sullivan, thank you so much, and we'll turn it back over to you.
Well, thank you, Dr. Dawson and Dr. Williams. And so we want to open it up for any questions that you might have. I know that Mark Wilson is on the call, so I know that you guys have a full agenda, but if there are any questions that you might have that we may answer for you, or that you may think that the public may be interested in learning more about our summer programs, we'll answer any questions at this time.
Thank you, Dr. Sullivan. One question that I have is, and it looks like you guys have a very robust program set up for the summer, so kudos to you for that. But I did want to ask about the technology piece. So as we know, with the move to virtual this past year and the technology piece becoming very important, is that going to stay in place through the summer?
Yes. So students are assigned devices like they are assigned textbooks. And so they still will have those devices. They still will have the hotspots for their summer programs. That's an excellent question. To be honest with you, Councilor Quinn, I don't predict in education we will ever go back to a situation where technology is not an integral part of what we do. That's one of the things that this pandemic has done, is really leveled that playing field.
Excellent. Yeah. So as we all know, that a lot of ways that or one of the main ways that a lot of us adults access information now is being able to Google it. So it's great to know that our students will also that opportunity to contribute or reduce some of that summer learning loss.
Yeah.
Do any of my colleagues have any questions? Did see Counselor Hoyt on for a second, but Counselor Woods is also still with us. Counselor Woods, do you have any questions?
Yes, sir. Thank you, Mr. Chair. Appreciate you guys coming and presenting this today. One thing that jumped out and one thing would like to kind of get updates as we go on is the number of parents or students that are participating in the elective summer learning. And so I think that would be something that stands out to me, and I would appreciate if you guys wouldn't mind just following up and sharing some of that information as you go.
Absolutely.
Counselor. Hi, it's Sybil Scarborough with the Office of Mayor Randall Woodfin. I just had one question. First, I'd like to say this is an exceptional program, and it's great that you're addressing summer learning loss. The one question that I do have is there a robust plan available to get the information to parents so that we can have an equal amount of parents take part in this program, parents who may be at work now, because we certainly don't want any child to miss out on an opportunity such as this?
That's a very good question, Ms. Scarborough. We have a really a top-notch communications team, and one of our priorities was, just like you said, getting the information out to our parents. We have been on the radio station. We have used all of our social media platforms, and we also have the ability to do call outs to parents and send emails to parents notifying them of these programs. But I think one of the tried and true methods is for teachers to directly contact parents of students in their classrooms to say, hey, this is an opportunity that you can't pass up on, because this learning loss that we're facing it's not going to be a one summer thing to address. It's going to take multiple years to be able to start meeting the devastation, not only physically, but academically, that coronavirus has done to the community. We talk about long haulers when they talk about individuals who have coronavirus who don't clear of the symptoms very quickly. There are going to be some academic long haulers that we're going to have to spend multiple years addressing. And one of the things that we're doing in addition to these summer programs is that we're starting school a little bit earlier. We're starting on August the 2nd, and we have intervention periods between grading periods for next year so that we can provide some additional supports for students. And so this is going to be a multi-year process. And so, yes, communication is going to be the key, getting this information out to parents, letting them know that they have this opportunity and that we are taking away barriers. So if you don't have transportation, we're providing transportation. If you're concerned about meals, we're providing breakfast and lunch. If you have to work and you can't pick up your child who is in kindergarten through 5th grade by 3 o'clock or by 1 o'clock when the program is over, we're providing after school care for free. So we take away those barriers, but we got to get that information out. And one of the things that we're happy that you guys are giving us this opportunity, because this gives us another opportunity to spread the word about our summer programs.
Excellent, Dr. Sullivan. I know that Birmingham has a large number of grandparents that are raising grandchildren as well. So with that group, they may not be as internet or tech savvy and may be the ones who need paper in hand. Is there an effort to get that tangible written out form to them if they are unable to access the information online?
Dr. Sullivan, can I speak there? Yes, we actually have a flyer. Dr. Williams, I don't know if you have it, you can share it, but we definitely have a one-page flyer that outlines all of our programs. And we definitely can continue to work with our communication department to be able to have that distributed to our schools, especially since we have students in schools right now that can get that piece, but also probably look at mailers and also through our robocall system as well.
Excellent. Thank you so much, sir. And thank you, Counselor, for allowing me to ask those questions.
Yes, ma'am. Counselor Hoyt?
Well, I apologize for missing most of the presentation, but I know it was good because it's Dr. Sullivan and his team. So,
Yes,
but I just appreciate the work that you've already done, and certainly to our chairman of education. This is a great presentation, and I'm glad that they are here. And I was wondering, Dr. Sullivan, how we might help you to get this message out. And then, as this Dr. Dawson was talking, we're supposed to be thinking outside the box. So I thought about what if the council, at least my colleagues here, will be willing to consider putting it on the billboard, around, because parents are busy, but they do travel up and down these freeways. I just think we just need to do an all-out effort, and we got a few little funds left. At least I think we do, that we could help with that, because I just think it's so important for our young people. And I think we have to exhaust all of our, efforts to make sure that all of our children and parents know this offering that you have presented today. So I just want you to know that I got a little piece of change we can dedicate to these billboards, because and maybe they might do it free. I don't know, but I think that's an opportunity there to approach them, and we'd be willing. At least I'm willing to help, and I hope my colleagues are too, as education committee. But I think we can help and try to get that message out. And I'm glad you had a flyer. So Ms. Scarborough, thank you for bringing that up, because I was going to ask if they could send that so we can put it on our Facebook pages and all our media outlets and what have you. But this is wonderful. Thank you for the work that you all are doing. I know that it's making a difference.
Thank you, Councilor Hoyt.
Absolutely. One final question. So we have a lot of school-age children that may not be enrolled in Birmingham City Schools during the regular school year. Do those students have the opportunity to enroll in these summer programs?
So the summer programs are geared towards the students who were enrolled in school during the year, or students who will be enrolling in Birmingham City Schools. So if those individuals will be in our school system in the fall, then certainly they can participate. But if they're not going to be in the school system, then it would not be for them. It would be for students. They would have to go to the school systems that they were enrolled in during the regular school year.
Okay. All right. Well, thank you for your suggestion, Councilor Hoyt. That's something I think that we can certainly look into. In addition, we also have the capacity to utilize a text messaging robocall system, so we can also communicate out via that mechanism. But absolutely, I think that every parent needs to be aware that these opportunities are available.
Mm-hmm.
That we're going to,
Dr. Quinn.
Yes, sir.
And I guess if we can have Kim to even look into that, the billboard possibility, and then we can use all the other mediums that we use to get messages out.
Okay, will do. With that, we're going to move on to our next guest speaker, Dr. Mark Wilson from Jefferson County Department of Health. Dr. Wilson, this past week has been very impactful, I think, and certainly I think the information that came out of the CDC on Thursday spread like wildfire. I know I was up in Huntsville for the Alabama League of Municipalities conference, and it was the hot topic of conversation. If you could just give a brief update on kind of where we stand in terms of cases and percentage of the population that has been vaccinated, I'd appreciate any of that information you can share.
Sure, thank you for having me. So things are still looking relatively good in terms of our cases. They've really plateaued still going down very, very gradually, but we've been averaging about 40 new cases per day in Jefferson County, and that number has been pretty stable for the last several weeks. The percent positivity rate, which is another important number, has been staying below 5% the last few weeks. This last week, it was 3.7%. So that indicates both that our our numbers are pretty low and that we are doing enough testing to detect those numbers. So if that's something we have to keep an eye on, just to make sure that our numbers aren't down just because there's less testing going on. Now, there is less testing than there was when we had a big surge, but that's just because less people were getting sick and or exposed and having a reason to get tested. So there's still plenty of availability for people that need to be tested, and it looks like we are, still testing a fair number of people, well over 1,000 a day of people getting tested. If you look on some of the data websites like Bama Tracker and some others, you will see that there were a huge number of cases over the weekend. That is an artifact, just so you know. There were, every now and then, the state will find out that there was a lab somewhere that was not reporting, and you get a big data dump. So that's what that was. So don't be alarmed if you see that big. I think there were like 3 days in a row where we had several hundred cases reported over the weekend, late last week. Those were cases from several months ago that a lab had just failed to report and finally did. So again, our numbers in terms of the real time are about 40 new cases per day in Jefferson County. In terms of the vaccination effort, there is and has been for several weeks now plenty of vaccine in plenty of locations, so it's readily accessible. And in terms of the percentage of the population that has been vaccinated, if you look at people that have received at least one dose in Jefferson County, that's about 38% of the population overall. If you look at the number of people that are currently eligible to get vaccinated, and that's now 12 and over, that number goes up to 44%. And that's a little bit better than the state average. We're not the best county in the state, but it's certainly better than the average for the state. But keep in mind that, Alabama is one of the worst states in the country in terms of vaccination rates. So that's still concerning. In terms of people that have completed their vaccination, that's about 30% of our population in Jefferson County, or 35% of those that are 12 and over. So, in order to reach the herd immunity that we would hope to reach, 70 or 80% of the population from vaccine alone, we have a very long way to go, and we're really concerned, that our numbers have gone way, way down. I think that pretty much the folks that really, really wanted to get vaccinated have been vaccinated. I do believe that we still have a lot of people that are not opposed to getting vaccinated, but maybe are still just taking a wait and see approach, and then others who just haven't gotten around to it. It's not high on their priority list. There's some people that feel like they don't need it. Either they feel like they're invincible, or they've had the infection before, and they are under the false assumption that immunity is good, for long term, which it is not. Anyway, we do have a ways to go. All these major vaccination sites, like the airport, Crossplex, out in Bessemer, the UAB sites, those sites, which are capable, some of them, doing over 1,000 doses a day, have only been seeing 100 or 200 a day for the last few weeks now. So I think that, a lot of those sites have sort of come towards the end of their lifetime. The expense and everything of having those sites is just, the return on investment is getting worse and worse. So a lot of those will be winding down in the next 2 or 3 weeks, but there'll still be plenty of access through clinics, through pharmacies, and some sites that will remain. So we're not too concerned about that. Just as a reminder for folks that want to get vaccinated or have questions, we still have that Jefferson County Vaccine Call Center up and going. We're planning to run that at least till the end of July. And that number is 205-858-2221. It's easy to make an appointment by just calling if you don't have internet access. That is also a site where if you are a Jefferson County resident and you need transportation to a site in Jefferson County, you can call that number and we'll arrange free transportation for you. They'll take down your information and somebody from the health department will follow up with you. We are not providing free transportation to pharmacies or Walmart, places like that, just because it's hard to prove that somebody's not just going shopping. But a lot of the other sites that are, especially those that are geared towards underserved population, we have free transportation. You can also go to our Jefferson County Department of Health website, jcdh.org, to get more information about sites and also to for a link on just online registration for vaccine. So I think that's pretty much, well, let me say one other thing. We and some of our partners are, as we shift away from these mass vaccination sites, are doing some targeted vaccinations, like one-day pop-ups here and there. The Bessemer site that we set up in partnership with FEMA and the State Health Department and the National Guard, the state and the National Guard are giving us staff that we can deploy, and we will have that staff until the first week of July and until the state of emergency expires. Staff of about 10 National Guard personnel, which includes about 3 or 4 vaccinators and then data entry people, that will be at the direction of our health department to go to different sites, and they're available 7 days a week. So we are in the process of scheduling one-day vaccination efforts. Some of those are going to retirement homes, going back to nursing homes where they might have some a little cleanup to do from the initial efforts, but also potentially to schools, to large churches. We're looking for community events, maybe events from various municipalities where there are just people hanging out, and we can set up vaccination opportunities to capture those people that again might not be making the effort to make a special trip somewhere. But if you are, happen to be there and we just say, hey, while you're here, would you like to get vaccinated? Then we might be able to do some of those folks. So if any of you know of opportunities like that, let us know and we can try to get those on the schedule. Again, that's an opportunity we have until the first week of July. So I think that's pretty much what I wanted to share with you all. With the children aged 12 and over now able to get vaccinated, we just really encourage folks to take advantage of that new opportunity. We know this vaccine is really safe, really effective, and it does work better than the natural immunity. It lasts longer, it's a stronger immunity. Well, let me also say, we may be enjoying something approaching herd immunity right now because of the combination of vaccines and the natural immunity that people had from the huge surge that we had in the winter and the fall and winter. However, the big concern is as that immunity wears off from those people that had actual COVID, say November, December, January, if that immunity wears off, say, maybe this next fall, and not enough people are vaccinated, we could have another surge as next fall and winter approach. So just a warning to everybody not to be complacent, and please get vaccinated. If anybody has questions, if anybody wants us to do educational sessions, we've done tons of them, but we would be happy to do more. For anybody that wants us to do that, we'll be happy to do it.
Dr. Wilson, what's the conversation around providing paid time off to employees? I know a lot of hourly workers, that's a concern that, anytime that they're not working, obviously they're not making money. And a lot of these folks are, low wage workers. So every hour counts. So is there any conversation around providing paid time off for those folks?
I think there's been some conversation at the national level about that. Certainly not something we as a health department would be involved in. But I will say, that we had been collecting information on employers that wanted us to come to them to vaccinate at the site of employment. And we are doing some of that as well with these teams that we are sending out. So that's still an opportunity for employers, especially larger employers. We will go to them if they can sign up enough people to make it worth our while.
Okay. We did have a question about the upcoming Memorial and July 4th holidays. Traditionally that's a time where folks get out and get together, and with, being in a situation where we have not yet achieved herd immunity, those could potentially pose a risk. Do you have any thoughts to share about the upcoming holidays?
Well, we really don't want people to let their guard down, that's for sure, especially, indoor activities. Now, we do have some evidence that being outdoors is safer than we at one time thought it was. Certainly, as you've heard from the CDC, if folks are vaccinated, they really don't have to worry as much. If folks are not vaccinated and they're really congregating and either indoors or outdoor situations that are very crowded, like I think one of them that makes me nervous is like a wedding reception that might be outdoors, but people are dancing and just really, really crowded. Those still make me quite nervous if those folks are not vaccinated. I think that Memorial Day and July 4th will probably not be nearly as impactful in a negative way as they were last year, but we still just don't want people to get too complacent. And we still want people to wear masks if they're not vaccinated.
Yeah, so just for context, I believe you said that the current rate is about 40 cases per day. I believe that, when we were having some of the surge of cases, we were 300 or more a day. Is that right?
The surges, like the surge in the summer that we had, we got into the 300s. And then the surge that we had in the fall and the winter actually got up into the 600s. And in both of those cases, our hospitals were really overwhelmed, especially in the fall and winter. I mean, they had reached their limit. So, again, I don't think we're going to see that again. Our hospital numbers are really looking pretty good. I don't even look at those as often as I used to, but we've been averaging about 50, 60 people in the hospital. It goes up and down a little bit, a lot better than it had been at one point.
Okay, Councilor Woods, Councilor Hoyt, you guys have any questions for Dr. Wilson?
Yeah, I'm a little challenged this morning, this afternoon. Dr. Wilson, and I guess I got the same kind of question in terms of how we get the message out, because I know that there was an initial announcement that we were doing the testing at Crossplex. And, and of course, if it's not riveted in the minds of the people, then certainly they forget. And so what about Ms. Scarborough, since you're on here, is there anything on the digital board that would suggest that testing is being done at the Crossplex?
You mean vaccinations, correct?
I mean, yeah. What did I say? Yeah.
Testing, which I've done the same thing a zillion times.
Okay. Vaccination. I'm sorry. Yes.
I can look into that, counselor, and give you a call back. I can actually drop off this call and find out for you, because I agree with you 100%. We've got to let people know, and some people may not know. And we have neighborhoods and so forth and places, and you come out on the Fridays and you see a large amount of people, and there is that concern, is that person vaccinated? Are they not? And do they know? And with me, information and letting people know is just always so important. And sometimes people just don't take part because they didn't know it was available. So I will definitely look into that, sir.
Okay, very good.
Yeah, and I'll say we've done a huge media campaign. I mean, on vaccines, using pretty much every media we can think of. And ourselves, UAB, and the state also are starting have and are still planning to employ people to even go door to door. We've done text messages to everybody that we have cell phone numbers for in Jefferson County. Just, lots and lots of things have been done. But I think in some cases, it's kind of like some people have to hear it for the 9th or 10th time before they finally say, okay, I'm gonna finally get it done.
Dr. Wilson, what about opportunities for folks to get vaccinated, say after hours? What happened? Is there vaccinations available between 5 p.m. and 8 a.m. in the morning?
Yeah, at the Bessemer site, they shift the hours on certain days to include the evenings, and of course they have the weekends as well. This is going to be true for a lot of pharmacies, but you're right, that has been an issue. I think a lot of the sites have been set during regular daytime hours, which is an issue for access. But I think at this point, people can get it if they need it, even if it's after hours. A lot of the urgent care centers as well are have extended hours.
All right. So, I assume that they're still moving forward. I mean, under present circumstances, of course, there's certainly seems to be an abundance of vaccine available, and I would assume that would continue moving forward. And if some of these large vaccination sites do pull back, the vaccine will still be available at pharmacies, those urgent care clinics, from your primary care physician and others. So there'll still be plenty of opportunities to get vaccinated when folks, are ready to do so or get the opportunity to do so.
Yes, that's correct. Yeah, there'll still be multiple places where people can get vaccinated. UAB, just by the way, is continuing their vaccination site at the Highlands parking deck, even after they close the other sites.
Okay. Any additional questions for Dr. Wilson before we finish up?
No, I just want to add one or ask one that you just kind of let us know if there are things that we can be doing to kind of assist. Don't hesitate to kind of ask, but definitely much better hearing the numbers where we are now. I know this time a year ago, it was a lot different situation. Now we're kind of in a spot where we can start to see some light at the end of the tunnel if we can kind of finish strong, so to speak, finish doing what we need to do. But do want to really commend you for the work that you've done over the last year. You and your team have definitely made yourselves available to speak at everything from neighborhood associations. Basically, if there were more than 2 people there, you were willing to send someone to speak to educate. So really appreciate that, as well as the regular briefings and available data being pushed down. So I just want to commend you guys for really doing the job in the crisis and stuff. A lot of times you never know how your team and things will respond when you get hit with something like that, and I appreciate it. But yeah, definitely, the numbers are looking much better. So hopefully we continue on this trend and get over the hump. But like I said, if there are things that we can do, please 100% let us know.
Thank you.
Just ditto to what Council Wood has said. You all have done a great job in trying to get that message out. And so we appreciate that very much.
Thanks very much.
Absolutely. Well, thank you, Dr. Wilson, also for taking the time to join us for this committee meeting today. It's been very helpful. We, keep up the good work, and we're here to help as well. Thank you.
Thanks so much. And yeah, I'll be happy to come back. And again, we're happy to talk to anybody, anytime. So let us know.
Okay, great.
All right.
With that, gentlemen, we do not have any other items of business on the agenda, so we'll entertain a motion to adjourn if you'd like to do so.
Second.
All in favor, say aye.
Aye.
The ayes have it. Meeting adjourned.
All right.
Thank you.
Thank you so much. Great meeting.